Today we're doing a deep dive into something, well, incredibly common. Heartburn and bloating.
Very common. But the thing is, they can be deceptive, can't they? Our sources really highlight this.
Exactly. Deceptive. These symptoms are putting on a performance sometimes. Master mimics is the term used.
That's it. Master mimics. And that's the mission for you listening today, to understand why these feelings happen, sure, but also what they might really be signaling.
Right. So knowing how to read the signs and when it's more than just indigestion.
Precisely. When you need to stop self-treating and actually see someone.
Let's get into the mechanics then. Starting with reflux, that burning feeling. The sources suggest it's not always about having too much acid.
Correct. Often it's more of a structural thing, a mechanical failure. We're talking about the lower esophageal sphincter, the LES.
LES, so a little door.
Think of it like a one-way trap door between your esophagus and your stomach. It's supposed to snap shut after food goes down.
And reflux happens when it doesn't.
Exactly. If it's weak or relaxes when it shouldn't, stomach contents, including acid, can splash back into the esophagus, which isn't designed for it.
So the plumbing's faulty, not necessarily the acid production itself.
Often, yes. Now, bloating is a bit different. There seem to be two main paths here.
Right. One sounds pretty straightforward, just swallowing air. Aerophagia.
That's the simple one. Chewing gum, drinking fizzy drinks, eating too fast, you just swallow air. It builds up.
Makes sense. But the other cause, more complex.
That one involves your gut microbiome, specifically carbohydrate intolerance. If you don't absorb certain carbs properly in the small intestine.
Like sugars or fibers?
Exactly. They travel down to the colon undigested, and the bacteria there, they have a field day. They ferment those carbs.
And fermentation produces gas.
Lots of it. Hydrogen, methane. That's what causes that deep, uncomfortable bloating. And interestingly, the same things, like fatty or spicy foods, often trigger both reflux and this kind of bloating.
Suggesting a link then. A shared weakness in the system.
It certainly points to a connection, a vulnerability.
So if that trapdoor, the LES, keeps failing regularly, that's when occasional heartburn becomes GERD, right? Gastroesophageal reflux disease.
Yes. GERD is usually defined as having reflux symptoms more than twice a week, persistently. And it often comes with other signs, like a chronic cough, maybe a hoarse voice, sometimes even trouble swallowing.
And that's where the real danger starts, according to the sources, because the esophagus lining, it just can't handle that constant acid exposure.
It really can't. Long-term untreated GERD leads to esophagitis, that's inflammation. That inflammation can cause scarring and narrowing, called strictures. But the most critical risk is Barrett's esophagus. That's where the actual cells lining your esophagus change type to try and protect themselves. It's considered precancerous.
Precancerous, wow.
And it significantly bumps up the risk for esophageal cancer. So chronic heartburn isn't something to just ignore and pop antacids for indefinitely.
This is crucial then. Distinguishing GERD, well, from its mimics, things that feel similar but are totally different, potentially life-threatening issues. How do we tell?
This is where you need to be a detective about the context of the pain. Heartburn is usually linked to food or lying down or bending over.
Right. Predictable triggers?
But cardiac pain, like angina or a heart attack, that's often triggered by physical exertion or sometimes intense stress, even cold weather. Very different triggers.
And the pain feels different.
Critically, yes, cardiac pain often radiates. It doesn't just stay in the chest. It might travel to the jaw, the neck, the back, down the arms. That spreading pain is a major red flag.
A huge red flag. What about other mimics? Intense stomach pain, gallstones maybe?
Gallstone pain is often quite distinct. It tends to come on suddenly, gets intense fast, and is usually felt in the upper right or maybe the center of the abdomen. And here's a key thing. Antacids usually don't help much, if at all.
So if antacids don't touch the pain, think gallbladder. What about bloating mimics, like celiac disease?
Right. Celiac disease definitely causes bloating because of malabsorption, but the clue there is often the other symptoms that come with it, things outside the gut.
What?
Unexplained iron deficiency anemia, maybe bone density loss, even neurological issues. It's a systemic problem, not just digestive discomfort.
So putting this all together, let's talk action. When does heartburn or bloating become an emergency? What are the absolute red flags?
Immediate emergency. We're talking severe chest pain, especially if it radiates, like we discussed, arm, jaw, back. Add shortness of breath, maybe a cold sweat, dizziness, or vomiting blood or passing black tory stools. That indicates bleeding.
Those are 911 situations. no hesitation.
Absolutely. Call for help immediately.
And what about non-emergency but still need to see a doctor situation?
So you should definitely book an appointment if your heartburn is happening more than twice a week or if it's been going on for more than 2 weeks despite over-the-counter treatments. Also, unexplained weight loss or difficulty swallowing those need checking out. But perhaps the single most important flag, stressed in the sources, is any new digestive symptom, heartburn, bloating, anything really that starts after the age of 50.
The age factor, why is that so significant?
Because the risk of more serious structural problems, including cancers, increases with age. Any new persistent gut symptom after 50 warrants a proper medical evaluation to rule those things out. Don't just assume it's simple indigestion because you're older.
That focus on change, on a new pattern emerging, feels really important. It's not just the symptom itself, but the change that matters.
That's the final thought, really. Your body often signals problems not with a constant siren, but with a change in its usual patterns, especially new gut symptoms cropping up after 50. Listen to that change. It's probably the most critical clue your body can give you. Don't ignore it.
If you enjoyed this video and found it helpful, please take a second to like and subscribe. Your support means everything to me.